Well, welcome everyone to the United Way of Johnson and Washington counties and their COVID-19 update. Today, we will focus specifically on the Delta variant, vaccination, masking through this panel discussion. My name is Barbara Thomas, and I am the Executive Director of Communications and Alumni Relations at the Tippie College of Business here at the University of Iowa today. And I will serve as your moderator. So I do want to remind you before we get started that for those of you who would like to make sure that you see our speakers as large as possible, please go up to the top right corner of your screen and select speaker view, and that will make sure that you see our speakers as they are addressing the audience. So during today's webinar, our panelists will utilize this time to educate us and answer your questions. We want to thank everyone who submitted questions to us. We received quite a lot of questions, and so we will answer as many of those as we can, but please know that there will be a possibility that we will not get to them all. Now, because of time restraints, there will be no time for discussion, no time for additional questions, but our event is recorded and it will be shared to you from the United Way of Johnson and Washington counties. So it is my pleasure to introduce our speakers today. First, Dr. Daniel Diekema is a professor of infectious diseases at the University of Iowa, Carver College of Medicine, and the hospital epidemiologist at University of Iowa Healthcare. He has been involved in UI healthcare response to the COVID-19 pandemic and is also involved in patient care and research related to COVID-19. Sam Jarvis is the Community Health Division Manager for Johnson County Public Health. Sam has been with the Health Department for 3 years and in local government public health for 10 years in various areas including communicable disease, environmental health, and emergency preparedness. Dr. Stephen Scheckel is the Vice President of Medical Affairs and the Chief Medical Officer at Mercy, Iowa City. Steve served as the medical director of Mercy's emergency care unit before accepting the role of vice president of population health, quality, and outreach. He has served as Mercy's chief quality officer since 2015 and also currently serves as their chief medical officer. So as we begin our panel today, I would like to ask each of our panelists for just a few quick opening statements, a few thoughts as we move forward. So as we begin with this, I'm going to turn to Sam Jarvis first. Sam?
Hey, good morning or good afternoon, everyone, and appreciate everyone being here. First, we'd like to thank our partners at United Way for hosting this on such short notice, and our partners at Mercy and the University of Iowa Hospital Clinics today. As we all know, information is changing pretty rapidly and has been throughout the entire pandemic. And so we know how important it is to be able to get information out to our community and provide local trends and updates as quickly as possible. So one, that everyone can be informed and be able to make the best decisions. And so I appreciate the opportunity today to provide those updates on what we're seeing with our local disease trends, as well as continue to discuss the safety and efficacy of vaccines. So thank you for being here.
Thank you. Dan?
Yeah, I would just like to echo that. I'd really like to thank all the organizers for inviting me to contribute to this discussion. And I guess the only other thing I'd say is, as we embark on, an hour or so of talking about preventing the spread of a virus, I just want to remind everyone on the call that no individual prevention approach is perfect. All of our measures have limitations. And that's why we in public health talk so much about layers of prevention. So it's not only about vaccination or only about testing or only about masking. The best way to protect yourself and others is to practice multiple layers of prevention. Even though there may be limitations to a single prevention layer, it doesn't mean that it isn't still essential to halt transmission and get us beyond this pandemic. Thank you.
Great, thank you. Steve?
Yes, thank you. And I also want to thank United Way of Johnson and Washington County for hosting this. I think it's an extremely important topic. It has been, but it's even getting more so as we're entering this next phase of the pandemic. And I feel fortunate to be here with Sam from Johnson County Public Health, and also Dr. Diekema, who is truly an expert in infectious disease. And I appreciate both of you spending time addressing this. As many of you are watching the news, you probably have seen some of the same headlines I have. It certainly got my attention, and I just want to share a few of them and to kind of tee up the conversation that we're going to have. The first one is, and these are just within the last couple of weeks, new United States COVID-19 cases up over 800%. Many highly vaccinated areas now high risk. Okay, next one. American hospitals buckle under Delta with ICUs filling up. Next, and this is extremely important, pediatric COVID-19 cases up 84%, okay, across the nation. And finally, number of US children hospitalized with COVID-19 hits record. Dallas, out of pediatric ICU beds. So this pandemic is not only continuing, it's reaching out to areas where previously we thought were relatively safe. So, and our pediatric population, particularly important when our children are going back to school. And also under age 12 are not able to be vaccinated yet. So very important topic to revisit. And once again, thanks to all of you for having enough interest to be on this call. So thank you.
Great, thank you, Steve. So let's start first with some information, some updates if we could. And Sam, I might turn to you first. Specifically about vaccination rates. Can you give us an idea of what the vaccination rate is in Johnson County or in our area? And when you have those rates, do you get any demographic information, or is it just simply the vaccination rate?
Yeah, sure. And thank you for the opportunity. As we've reported out recently in the past couple of weeks, when we were looking at our total population, we're roughly about 60% vaccinated, fully vaccinated. And so we continue to be here in Johnson County, the highest vaccinated county in Iowa. So thank you to all of our community members for doing so and recognizing the importance of doing so, because that not only protects yourselves and your loved ones and family members and friends, but it protects the rest of the community as well. And so we continue to make good progress on that front. Over the past month and a half, we have seen a decline in the vaccination rate. So we're really looking at small amounts each day across our community. And so we've seen a small uptick due to the concerns of the Delta variant, but not as substantial as we'd like, as we'd really like to continue to approach 70 and 80% and more of our population. In terms of age splits for our vaccination rate, to dive a little bit deeper into that information, as we once reported, we have high vaccination rates in our older adult population, which is extremely important. As many know and recall, our older adult population and those in long-term care facilities were at highest risk due to a lot of factors. And so getting those persons vaccinated quickly and early on when we were going through the phased approach for the entire state was really crucial. And so we continue to see high rates of vaccination in our older adult population, somewhere beyond 90% and higher. So that's wonderful to see, and we're maintaining that. As we dip down into lower decades, we are starting to see a smaller decline in vaccination rates. And so really across the board, 20, 30, and 40, 50 range, we're around 50 to 70% for some of those. But our lowest vaccinated rate age range is really around 18 to 19. And so we continue to make progress with promotion and making sure we get information out to those age groups and really express the importance of vaccination for their lives. We know that there's a lot of barriers. We know that there are questions and concerns out there, so we continue to work to address those. But in terms of vaccination, again, can't be grateful enough for this community to recognize how important that is. And really, as we go forward, we'll continue to ask everyone in our community to continue to show empathy and compassion to helping describe the many reasons why persons should get vaccinated. So
Right. And so just to reiterate that Sam has let us know that the overall Johnson County vaccination rate is at about 60%, correct?
Yes. And then if you're looking at our total eligible population, so 12 and older, we're closer to about 75%. So wonderful progress, but we need to
Great.
keep going.
Good. So what can you tell us about current cases of COVID in our county?
Yeah, wonderful. We are seeing the trend that much of the rest of the state and the nation are seeing, which is a pretty dramatic increase in cases. As many are aware, Johnson County is classified as high transmission right now. Roughly 81 counties in Iowa are that status per the CDC's data tracker, which really we've been pointing a lot of folks to, especially during the summertime as they make travel plans, as they travel to see family. We know summer vacations are happening right before the school year starts. So to put that in perspective, the rest of the nation, roughly about 84% of counties in the US are also at high risk transmission. So that's looking at 100 cases in a week per day per 100,000. So we're certainly not trending in the direction where we want to go.
Right.
To put this in perspective locally, though, during July, we saw single-digit cases in a day, some of the lowest amounts we've seen since the beginning of the pandemic. And every couple of weeks, we've seen that stepwise an increase since then. Just 2 to 3 weeks ago, we were seeing 10 to 15 cases a day. Currently, as of today, we are looking at roughly 30 plus cases a day. So it's not been a dramatic exponential increase like we've seen in the past with some surges and waves of cases, but we are trending upward. To describe those cases a bit more, they're typically in younger age ranges. And that coincides with the vaccination rate with our older adult population. And so really the average age is roughly around 30, and it varies across the board, but the bulk of those cases are adults at the moment. And primarily we are seeing cases appear in unvaccinated clusters. So unvaccinated households are a trend, as well as daycares. And so we continue to monitor those and coordinate with those centers and those organizations as best as possible to help implement those mitigation measures. So those are really the trends that we're seeing right now.
Now, what about hospitalization numbers? Do you know what those are?
For the state, those are shared with us, and roughly about across the entire state of Iowa, I believe there's around 400 persons hospitalized right now due to COVID. Roughly about 100 of those are ICU patients.
Got it. Now, Dan, this next question might be best for you. Is that who are you seeing is the most affected by COVID now that we're kind of at this stage in the pandemic?
So the most affected group, those that are most likely to end up in the hospital or dying from COVID-19 now, are the unvaccinated. And so we have seen some shifts in terms of age groups that end up, in our intensive care unit or in our hospital. And the change in the proportions by age group are really almost directly correlated with the percent in that population group that's vaccinated. So we have, and we'll maybe touch on this later, but one of the things that we're learning, and just some really good news from a couple of CDC publications just in the last couple of days, are showing us that the vaccines are remaining very durable protection to this point against hospitalization and death due to COVID-19. So really the short answer is it's the unvaccinated population that we're seeing by and large in the hospital.
Got it. Now, Steve, you could kind of give us some insight. Is Mercy Hospital, for instance, seeing a lot of severe cases? And then if so, do you have COVID cases in your ICU? And after you let us know, I'd appreciate the same information from Dan if he has it for UIHC.
Sure. Just similar to what's been described, we are seeing an uptick in COVID cases, and fairly dramatically, but not exponentially. And the severity, we're still seeing severe infections, but as Dr. Diekema mentioned, they really are in individuals who have not been vaccinated. And I think a lot has been talked about regarding breakthrough infections for people that have been fully vaccinated. We have seen those patients, but as the experiences across the country, those people who even require hospitalization tend to be not as ill and don't end up in our ICU. And the fact that there are breakthrough infections, even for fully vaccinated people, have given sort of the ammunition to some of the anti-vaxxers that, well, the vaccine doesn't work. That is absolutely not true. What it does, yes, there can be breakthrough infections, but the people that do have these breakthrough infections, just as mentioned, tend to be not as ill, sometimes requiring hospitalization, but for the vast majority, preventing death and severe illness. So vaccinations are life-saving.
Right. Now, Dan, I know for UIHC, I believe it might be the one pediatric ICU in our area. It could be wrong, and if so, I apologize to any other hospital out there. But are we seeing patients at UIHC, pediatric patients specifically, in, getting to the point where they're in the ICU?
So that's still fortunately quite unusual for us. So we're still staying with numbers, of less than maybe 4 or 5 pediatric patients in the hospital with COVID-19, and just 1 or 2 have been in the ICU in the recent past, to the best of my recollection. I look at the numbers every day. I haven't looked at today's numbers yet. But in terms of the adult population, as was just mentioned, we are seeing upticks in our numbers, but for comparison purposes, I think at the peak of the largest surge we had in November and December, we had over 100 patients in the hospital being treated for COVID-19, and had implemented, a surge plan to increase our capacity in the intensive care unit. At this point, we're still in the 20 to 30 range for total number of patients in the hospital for COVID-19. That's obviously up from where it was a month ago, but it is lower than it was during the peak of the surge. So we're hoping, of course, that it doesn't reach those levels again. But one of the benefits I think we have during this current surge is, as Sam mentioned earlier, we in other areas of the country have been really good at vaccinating those over the age of 65. So the vaccination rates in that population have been, really the highest of any age group. And that is the age group that is at highest risk of requiring hospitalization with COVID-19. So we may be seeing some of that impact.
Great, thank you. Now, this also may come back to you, Dan, in that, what can you tell us? You're an epidemiologist, so what can you tell us about what we learned about the variant strains of COVID? I think for the common man like me, I think of this flu. How has this changed? What have we learned about it?
Yeah, so it's helpful to understand that every virus mutates, every virus changes its genetic sequence over time. Some viruses faster than others. And so and it only does that when it's replicating, obviously. So as a virus spreads quickly through a population and replicates in very high numbers, there are going to be a lot of mutations, and it's a survival of the fittest situation where the viruses that are best able to reproduce themselves and be passed from one host to another, in this case, people, are the ones that tend to predominate. So what has been done from a public health standpoint is that there's been careful monitoring of the viral sequences over time. And those variations in the virus that are most successful end up getting names, and they're called variants, first variants of interest, and then variants of concern. And what it means to be a variant of concern is we're saying that particular variant of the virus is either more transmissible, resistant to treatment, or maybe can escape certain immune therapies like antibody treatments or vaccines. If it meets any of those criteria, it's called a variant of concern. And we've seen several now come and go. And the one that we're currently dealing with, Delta, its superpower, if you will, is its ability to spread extremely quickly and efficiently through populations. The reason it appears to be able to do that is some of the mutations, some of the changes in the virus allow it to attach and adhere much better to respiratory tract cells than some of the prior variants. So it has an advantage of causing infection. And then once it enters respiratory tract cells, the cells in our airway, it tends to be able to replicate to much higher numbers than some of the previous variants. So that means that when people are exposed, they're more likely to get infected. And when they are infected, they shed higher numbers of virus and more efficiently spread the virus. So that's really where we are with Delta. But the corollary here, or the logical extension, is that the best way to prevent variants from emerging is to prevent the virus from replicating. And wherever there are areas of the country or areas of the world where the viral spread is unchecked, those are the areas where we're going to see concerning variants emerge. So I think I'm stealing a quote from someone, probably Daniel Griffith, who has a podcast on this, a physician in New York City, who says no one is safe until everyone is safe. And I think that's really true. So I think we obviously need to focus on our community here and what we can do to keep everyone here safe. But as long as we aren't also preventing transmission in all other parts of the world, we're going to keep seeing these variants emerging.
Now, does this Delta variant, is it transferable more through the air or touch, or is there certain things that would make it more, I've heard this one's more of an airborne transmission.
So I'm happy to get Sam's take on this too. This has been a very hot topic from the very beginning of this pandemic, is how is SARS-CoV-2 spread? And I think what we've learned to this point is that from the beginning, there is what you can refer to as airborne spread of this virus. And that's important to distinguish from certain other pathogens. And when we talk about airborne transmission, because for SARS-CoV-2, most of the transmission is still in relatively close proximity. So what it probably is mostly is small particle aerosols that are generated, and the transmission is most efficient when people are within 6 feet or so of each other without wearing any kind of personal protective equipment over their mouths to prevent aerosol emission. But particularly in poorly ventilated and crowded indoor spaces, these aerosols can build up, and transmission can occur over longer distances and for longer periods of time. So that's really typical of an airborne virus. I think this has been the case from the very beginning with SARS-CoV-2, despite the fact that initially, based upon what we understood from previous coronaviruses, many felt that droplet transmission, or large droplets that fall to the ground within 3 to 6 feet, were the primary mode of transmission. And I think this is just one of many areas where we've just learned from hard experience during this pandemic about what makes SARS-CoV-2 such a difficult enemy to combat.
And one thing I might add, I think initially there was a big concern about the virus being on surfaces and being transmitted that way. And I think we've come to understand that it's mainly by airborne transmission. And certainly the small droplet versus the large droplet, in small aerosolized droplets it has the potential to go beyond 6 feet, which is potentially problematic. But I think the surface spread is less of a threat than certainly the airborne. Is that your understanding, Dan?
Yes, I mean, it's still important, to adhere to standard approaches to surface disinfection, and hand hygiene is always important.
Yeah.
But I agree with you that most of the data to this point suggests that this kind of mostly close proximity, but still aerosol/airborne transmission has been the primary mode.
But certainly hand washing all the time.
Yeah.
Right. The other thing is that there have been cases about people who are vaccinated being able to transmit the disease. Is that correct? Steve or Dan, is there anybody who could speak to that?
Yeah, I can get started on that. I have read different papers or publications about that particularly with the Delta variant, which has such a large viral load, that people who are vaccinated who might have actually have the virus and even being asymptomatic or minimally symptomatic, and you might call that a breakthrough infection. Because of the high viral load, they can unfortunately transmit that virus to others. And I think that's why the CDC recently came out with a recommendation for even the vaccinated people in close quarters to wear a mask, where initially we thought we had a little light at the end of the tunnel where vaccinated people could get together in close proximity with other vaccinated people safely without masks. I think that attitude has changed a bit because of the high transmissibility of the Delta variant.
Yeah, I agree with that. I think it's important. It's an extremely important point that it is possible for fully vaccinated individuals, that small proportion who do have what's being referred to as a breakthrough infection. I don't love the term breakthrough because it implies the vaccine isn't doing what it's designed to do, which it is. So those infections that occur after vaccination can still be transmitted, but much less efficiently, and there's a lower risk. And I just put a link into the chat from a recent study published from the Netherlands, which is the largest study to date that I'm aware of, that really closely looks at how effective is the vaccine at preventing transmission. And in this very large study, which was mostly the Alpha variant, not Delta, there was a 70% vaccine effectiveness against transmission. And I think that at least relatively speaking, it's going to be a similar risk reduction for Delta. The absolute numbers might be higher because Delta is more transmissible across the board, but I think the risk reduction is going to be consistent.
Thank you. So when we think about the vaccines, everybody who has been vaccinated has received one of 3 different brands shots. Is there any information that shows one is more effective than the other? I think we can all agree that basically whatever you can get, you should get, because it's going to help you avoid getting or having a bigger reaction to COVID. But there is some concern, especially for those people who have had the one-shot Johnson & Johnson. There has been a few questions submitted about the change in effectiveness, or are they all fairly similar? Anyone want to take that?
I'll get started again, then I'll let either Sam or Dr. Diekema join in. But certainly the published effectiveness is fairly similar initially for the mRNA vaccines. That would be the Pfizer and Moderna. The Johnson & Johnson did not have quite as much effectiveness as the mRNA vaccine, but all of them are very effective at preventing death and severe illness. The other point is that with the Delta variant being the predominant variant across the United States, the effectiveness of the Pfizer and the Moderna has decreased a little bit. Just from the studies I read, the Pfizer a little bit less effective than the Moderna against the Delta variant. And also they're looking at the effectiveness waning over time as the antibody production decreases. And that's why they're suggesting the booster shot. But and I'll let Sam or Dan elaborate on this, but they're all, the point is they're all effective, very effective against severe illness and death.
Right. And I think that does bring up a topic that we have heard a lot about, which is the booster shot. And so I have heard everything from 6 months out from when you were vaccinated, 8 months out, that some people have felt like if you had Johnson and Johnson, you should try to get a booster. I know that this changes probably every day, but what is the current thinking on when you should consider having a booster shot? Sam?
Yeah, great question and appreciate that. So just recently, our federal partners have released information about really what their tentative plans will be going forward this fall. We know that as of last week, the recommendation for severely immunocompromised persons getting a third dose has been recommended. And so that's in the process now. And certainly it's a small subset of persons, but we're getting those phone calls here, and I'm sure our hospital partners are as well. And we're really directing them to have that conversation with their provider to learn a lot more if they're in that subset of persons. But it appears that tentatively near the end of September, the CDC notes September 20th, they will be rolling out a plan for what boosters may be for the general public. And it's really based on and predicated on the research that they'll be looking at going forward, and then looking for a recommendation from the advisory committee on immunization practices. So I'm sure many are awaiting that determination and hearing more on that, but it appears that it will be 8 months after you complete the series. So we're waiting on that and more information for our state and federal partners. But if that kind of news causes some anxiety, to help with that, we do want everyone to note that we're in a much different situation than we were at the end of December, December 14th, actually, for here in the state of Iowa, and actually in our own very backyard, because one, the vaccine supply is still plentiful. There is no concerns of vaccine supply in our area, the state or the nation. And the other portion is that, due to our community recognizing the importance of the vaccination, at this point, 60% of our total population is vaccinated. So they have that protection already from severe illness and hospitalization. So we're in a much better situation. And so we'll wait information from our state and federal partners, and we'll be sure to share that out for to date and going forward, making plans already. So
one note to add to that, the initial boosters will be for the Pfizer and the Moderna, and we anticipate that Johnson & Johnson will also recommend a booster shot, or our CDC will. It's just they're doing the testing now, but right now, starting September 20th, as Sam has mentioned, 8 months after your last vaccination, you would be eligible for a booster shot for the mRNA vaccines.
Well, I know that a lot of people in our community, especially those that are parents of young children, are very concerned, and there's a lot of questions about when will the children under 12 be able to be vaccinated. And I know that's potentially a complete unknown, but do we have any insight into, testing or research or progress that might be made in that area?
Yeah, I bet Dr. Diekema might have some up-to-date information on that one.
Yeah, I don't have a crystal ball on that, but I'm hopeful that it is going to be, sometime before the end of the year. But because I know that the trials, I think, are getting close to completion, and data, needs to be presented to the FDA to expand the age category. Sam, have you heard anything?
We have not. I know that last word was hopefully in September, but I know that that research was ongoing. I believe they extended the trials for Pfizer, and I believe Moderna as well. So there's speculation that might extend that timeline a bit. So I know that there are many of us who are waiting on that information and everything. But as soon as that happens, I have no doubt that we'll be sure to share that. We'll ensure that our providers are ready, or all of our COVID-19 vaccine providers in our community, and that will be well supplied here, so that guardians and parents can make those appointments as soon as possible.
And the latest I heard regarding that is that right now they're focusing on all the age groups under 12, but I heard reports, and I don't know how accurate they are, but the 5 to 12 age group, they're hoping sometime mid to late fall to might have preliminary approval for that. And with everything going as well as possible, the 6 month to 5-year-olds may be even before the end of the year, but that's totally speculation. They are separating it into those two age groups.
Two different groups. Now, are children under 12 reacting differently when they do get COVID? Are we seeing kind of, I would assume it's still upper respiratory, but what are the effects that we're seeing in the youth in comparison to what is different compared to adults? Is there any, or is it pretty similar, the flu-like symptoms, respiratory?
Yeah, I'm not a pediatrician. I'm not a pediatric infectious disease physician. I would say that the major difference, it remains that the risk of severe disease and hospitalization remains lower. So as was mentioned earlier, we are seeing more children admitted to the hospital. They can get severe disease, but I think the reason we're seeing this uptick is just because so many children are being infected right now because they're the largest unvaccinated portion of the population. But by and large, it is a similar kind of respiratory, viral upper respiratory type illness for most kids. But as I mentioned, a small proportion can get very ill, and there are now increasing data that suggests that a small percentage, we don't know exactly what percent, can go on and develop some of the long COVID symptoms of fatigue, difficulty concentrating, headache, those kinds of chronic symptoms. And the estimates there vary anywhere between less than 1% to up to 10%.
And one thing that initially with the Alpha variant, it was more rare for the pediatric population to be affected, and they would it'd be more common that you'd hear about the multi-system inflammatory type of condition that affected the pediatric patients. But with the Delta variant, it's mimicking more what the adults have experienced with the respiratory illness, children having to be placed on ventilators, and so it's really expanded. And it must have something to do with the Delta variant, Dan. As far as the mutations go, so because it has changed.
Great, thank you. So, can one of you? I am a non-medical professional. I'm just going to put that out there, like that's no surprise. But I did want to ask, how is the protocol for testing? Has it changed with the variant? Is it the exact same test, but you're able to see different things? When you take the test, is it just that you have COVID, but they do or don't know that you have the variant?
Yeah, so I can answer that. I mean, the emergence of the variants hasn't had a major impact on the approach to testing. And the reason is that most of the molecular tests that we do that look for the genetic sequences of the virus have 2 or 3 different targets. So even if there's a mutation in one area, you still can detect the virus using those other targets. So we have not seen variants emerge, for example, that we just couldn't detect with the test we're using here or at the state hygienic lab or in most places. But though that is being carefully monitored by a lot of people, including diagnostic companies, to make sure that the tests don't have a negative impact, or the variants don't have a negative impact on testing. There have been a couple of the more rapid antigen-based tests that have shown decreased performance against a couple of the variants. And the diagnostic companies will, I think, respond to that. In terms of how do we know if it's a variant or not, at this point, we're still basically sequencing the genome of the virus to determine if it's a variant. So that's a separate kind of diagnostic test to the one that detects the virus. So if you go get tested, the first step is they'll see if the virus is present, most of the time using one of these molecular or PCR-based tests. And if it is positive, depending on what kind of sampling is being done in the laboratory, your sample might get sent to the state hygienic lab, for example, to be sequenced and to determine whether it's the Delta variant or some other variant. But the variants aren't treated any differently in terms of what we choose to use for therapy. So it's mostly for public health and prevention purposes that we track these variants. There's nothing, for an individual person who has COVID-19, there's going to be no change in what they need to do or what their providers need to do based upon what variant they might have.
And one thing I might want to add to that is that, once vaccinations started, everybody was very enthused about it. What we noticed was testing started to drop off. And I think that's unfortunate. I think it's very important that people continue to get tested. And that helps to, number one, identify COVID-19 and prevent the spread. And so we encourage people to have the same vigilance for testing that they did before we had a vaccine available. And my knowledge of the PCR tests out there, the polymerase chain reaction test, which are the most accurate, and the molecular test, they still identify COVID-19 independent of what variant we have. And the people are, particularly the laboratories, are keeping very close track of that. So the tests remain very adequate, very accurate. The challenge is more testing. The more testing, in my opinion, the better.
Great.
That's wonderful. I was only going to add that that's a wonderful point, Dr. Scheckel. Certainly the vigilance on testing is and will remain to be important. And in terms of the protocol, as we've seen the concern of the Delta variant and being more contagious, our protocol for disease investigations and contact tracing has been updated as well. And so even for those who are fully vaccinated and exposed, well, at that time, we're not asking them to quarantine. It is to self-monitor and then to seek out testing from days 3 to 5 after exposure. And that's really due to the concern that those who, even fully vaccinated, exposed and may become ill, can then transmit it to others. And so that, along with the protocol to wear masks in indoor spaces or universal masking in indoor spaces, really that's all tied to the variant as well. So.
Great. Now, Sam, I think what you said right there is very important. It's come up in a number of different questions. So I might want you to just reiterate it, is that if someone is vaccinated and has been exposed to COVID, that they should they quarantine for 3 to 5 days, 10 days? Should they, if they have a reaction, does that timeline change?
That's a great question. And I know that as time has gone on, quarantine and isolation protocols have been amended and updated, and it's confusing for many. So if you are fully vaccinated and you've been exposed to someone with COVID-19, you've had close contact, we won't be asking you to quarantine for the 14-day period, but we'll be to symptom monitor for that time frame, as well as wear a mask when you're around others for that concern. Then, as mentioned, to seek out testing from days 3 to 5. So again, fully vaccinated, you are able to avoid quarantine at that moment, but to have that vigilance because of the close exposure or close contact. So.
Now, we did have some questions about if people were vaccinated, is there a way to check their immunity levels? Is that a possibility? Or if somebody has had COVID, we have heard early on, we had heard that they might be immune for a period of time. Does that wane over time?
So I can address that very briefly. So the bottom line is there's really no test one can do to say you are immune or you're immune to this extent. We can check for antibody levels to the spike protein, which are felt to be possibly linked to protective immunity, but we don't know what level is required. And it's very important to understand that for a period of time after vaccination and natural infection, not just for SARS-CoV-2 or COVID, but for every infectious disease, antibody levels that are circulating will decline. But there are other forms of immunity that exist in order to remember those pathogens you've seen before and rev up antibody responses when you've been exposed. And one of the simple ways to think about why one might get a mild infection several months after the vaccine, but not a severe infection, is that it takes a little bit of time for the immune system recognize the invader, rev up antibody production, and what we call cell-mediated immunity, which involves the T cells. And that immune response is what keeps the infection from spreading to other parts of the body and causing more severe illness. So we don't have a good way to measure that kind of memory response right now that tells someone you're immune or you're not immune. So we don't recommend people get antibody tests just to see if their vaccine worked. The 5-second answer to the second question is immunity does wane after natural infection in some ways similarly to vaccination, but you can boost your immunity after natural infection by getting vaccinated. That gives you a very robust response and is possibly more protective even than the 2-shot series of the vaccine.
Thank you so much. So as we start to wrap this up, I do want to kind of come to each of our panelists to just share a final perspective, a final reminder for our community of how they can continue to be safe. I know there's a lot of concern in the community as the university students return to campus, as the K through 12 schools start to come back and children are coming together. There's a lot of anxiety among a lot of people with that. And so, as you think about your statements, kind of what advice you might have for the population as we look at these risk factors. So first, I'm going to go to Sam.
Given kind of the circumstances that we're in and what we've discussed today, that both Dr. Scheckel and Dr. Diekema mentioned, really implementing that layered approach is our best chance at preventing illness. And that's something that we all can do, whether fully vaccinated or not. And given the CDC's latest recommendations that we are recommending everyone to follow and to implement, it will be, again, staying home when you're ill or keeping your child out of school when ill. It will be to wear a mask in indoor spaces, for your cough, wash your hands. And ultimately, the best prevention measure is to get vaccinated. And we do recognize at this moment that there are some folks who cannot, are 11 and younger population. So we hope that we can impress upon everyone that as a community, we all can do those things to protect them as well. And really, as we go forward into the fall and we learn more about either the Delta variant or future variants, that until the pandemic is over, which no timeline on, but it will end eventually, what we do between these 2 points matters, and that we continue to implement the layered approach, and that we can encourage others, our family and loved ones who may still be on the fence to get vaccinated, that we can encourage them to get vaccinated as soon as possible. So again, appreciate everyone joining us today, and appreciate our expert panel from both our hospitals, and really hope that this has provided a lot of information going into the fall. And thanks to United Way for hosting us today.
Great. Thank you so much, Sam. Dan?
Yeah, I guess I would start by just acknowledging how frustrating it is for everybody, myself included, that we're still seeing our lives appended by this pandemic. I'm sure that many people on this call have lost loved ones during the pandemic. Most of us are just tired and want it to be over. But the message is that the fastest way to make that happen is, as Sam mentioned, through collective action, applying all the layers of prevention that are available to you to stop the spread of SARS-CoV-2 for yourself and for others, so that we can return safely to focus on all the other things that we'd rather be doing, that we need to be doing once the pandemic is behind us.
Great, thank you. And Steve?
Yes, thanks. Yeah, to kind of follow along that line, I think everybody recognizes that there is a lot of what we call COVID fatigue. we're tired. We thought this was going to be over, and unfortunately, it's not over. And I think people, number one, have to just recognize that, acknowledge it, and do what we can to help ourselves and help others. And the best way to do that is to follow the CDC recommendations. And high on that list, and probably the most important is, number one, get vaccinated. Number two, wear masks. Follow the recommendations to protect ourselves. We protect others. And so that's what I want to say regarding that. We're in this together. And in order to get out of it together, we have to all be vigilant and do our part. And so I do want to thank United Way once again from Johnson County and Washington County, and also thank our panelists. Johnson County Public Health has been a great partner as we've moved through this whole process, the whole pandemic, including vaccination and trying to keep us safe. And I always recognize the University of Iowa as the safety net for all of us. We truly appreciate the care that you provide there, the expertise, and the sort of the deep bench that you have to help all of the hospitals in our area and across the state. And so I do want to leave with one quote that I came across that I thought was just like right on the money. It was from actually a spiritual leader. It happened to be Pope Francis, but I feel like this could come from any of the great spiritual leaders, no matter what religion across the world. And it's just a recent quote that he said, and it is, I quote, "Getting the vaccines that are authorized by the respective authorities is an act of love. And helping the majority of people do so is an act of love. Getting vaccinated is a simple yet profound way to care for one another, especially the most vulnerable." And that is so true. By caring for ourselves, we care for others. By caring for others, we care for ourselves. So my message is to hang in there. We will get through this together, and get vaccinated. Encourage your family, friends, and everybody to get vaccinated, wear masks, be safe, and stay alive and stay healthy. So,
right. Totally agree so much. Now, I did ask for your closing remarks, but I do have a teeny bit of time, so I'm going to sneak a little question in that I know some of the people who have submitted questions asked about the safety of going to the doctor, going to a quick care clinic. I am assuming that all of the medical professionals in the area, for the most part, are vaccinated. But I think it's always good for us to hear from our hospital leaders about the safety of our facilities, about the availability of elective surgeries and things like that. Steve, can you address that?
Sure. I totally agree that our healthcare facilities, by the very nature of what we're trying to do, take care of people's health. We take every precaution to keep things safe. We want people to be able to access healthcare without fearing that it may somehow jeopardize them. And so I can't give you the exact number of how many people are vaccinated, but certainly widespread across the healthcare community, we get vaccinated because we recognize the importance of it. We take every precaution, including pre-procedure testing for all our patients that are appropriate to be tested prior to having procedures. Our ultimate goal is to keep, number one, our patients healthy, but also our healthcare providers and staff healthy so we can be there to take care of patients. So that's what I can tell you from Mercy's perspective, but I'm sure it's probably similar across other experiences.
Yeah, I agree with everything you said. At UIHC now, I did inquire this morning, and we're now over 90% of our healthcare staff are fully vaccinated. And all those other layers that you just heard about, we're testing patients admitted to the hospital every 5 days while they're in the hospital before procedures, creating as safe as possible an environment for care. We did have to implement our surge plan last November, December, during the very peak. We are fully engaged in setting the table to do that again if we need to. but with the full realization that we also need to continue to provide excellent care across the board to anyone who comes in and needs the highest level of care, that we have the capacity to do that. So I just want to reassure the audience here on this webinar that we do have that capability. And then finally, remind folks that when they go to their healthcare provider or healthcare facility, they also need to take the responsibility to practice the same precautions they do when they go to any other public place. And as Sam mentioned earlier, now masking in public indoor settings, which absolutely applies to healthcare facilities as well. And to just carefully determine prior to your visit what the protocols are at the office or clinic or hospital, and adhere to them.
Yep.
Great. Well, I want to thank, go ahead.
Oh, just one thing I wanted to add. As part of helping to protect our healthcare providers, all patients that come into our emergency department, they're treated as possibly COVID positive until we can prove otherwise or not have a reason to believe that's true. And also, as Dr. Diekema has stated, everybody coming into the hospital is tested to help all of the healthcare providers within the institution to protect them from inadvertently getting infected. So, in order to take care of our patients, we need to have healthcare providers and staff who are healthy to do that.
Exactly. Well, I want to thank all of our panelists for taking the time today and to participate in this. And throughout the entire pandemic, we have relied on our public health professionals, on our local hospitals like Mercy, like UWJWC, like the VA, to help keep our community safe. And so I think I speak on behalf of the community that we want to thank you and your organizations for all you've done to help guide us as we have moved through the pandemic. In addition, I want to thank all of the participants, especially those that submitted questions. Hopefully we've been able to answer at least a good chunk of them. And lastly, I do really want to thank the United Way of Johnson and Washington counties. Throughout this pandemic, I think we have all seen the value of our United Way. They have stepped up to the plate. They have provided us with information and have been a true partner throughout all of this. So I think it has shown us the true value of the United Way. Now, as a final reminder, I want to remind you that this session has been recorded, and the United Way will be sharing this out in a day or so. But lastly, I want to remind you, 1, vaccinate. 2, wear that mask, especially indoors. 3, watch your social distance. And 4, wash those hands. Use that hand sanitizer. They are simple steps, but they are definitely what these gentlemen have told us. They are the ways that we can show kindness and caring for the people in our community. And that if we want to get over this hurdle, this means that all of us have to do our part to kind of keep pushing further and further away from the reality of COVID. So with that, I just want to encourage everyone to stay safe and be a good, conscientious neighbor. So thank you all for joining us, and have a great day.